Hi everyone, I'm Melissa Grimshaw and I'm here to welcome you to Yale. So the first thing is that the Cushing Levy Medical Library is here to support you at your time at Yale or Yale New Haven Hospital. So the outline of this talk is that first I'm going to describe the liaison program, also called the departmental librarian. I'm going to explain how you can access the library both physically and virtually. And then we will showcase some library resources and services based on the ACGME core competency. So this orientation is specifically for trainees, so residents and fellows. A little more information about the liaison program is that each department has their own departmental librarian assigned to them, and we're available to help you with a lot of different things. So I'm Alyssa, and I am the department librarian for internal medicine, OBGYN, and urology. Things that I can help with is training and assistance with quality improvement and patient safety topics. So whether you're doing a quick search or you're doing a more involved project where you need a deeper dive in the literature. I can also help you with keeping current in the literature. So this is like setting alerts, tracking your own scholarly communication. This could also be different options for citation management and things like that. We are also available for helping in the graduate medical education. So if you are doing more administrative work, we can help you prepare for journal clubs, so that's helping to help you pick the articles that you choose, or if it's setting up a website so that way all the trainees or students that are attending these sessions have access to the material or one quick place to look. We also teach in the didactic sessions particular classes. So the advanced EndNote class is pretty popular. My systematic review methodology class is also frequently given in the graduate medical education to certain groups. So if you are looking to add to the curriculum that you set up as a fellow residents or as a resident for the other residents or trainees or students, just let us know, because I'm happy to teach anything that's on the library catalog or anything that I'm already teaching. But I mean, I think the biggest takeaway point here is that the liaison program is here to connect you with resources and services that you need for patient care, medical education, and research. So I am, like I mentioned, the internal medicine, OBGYN, and urology liaison. And I just like to do an about me slide because you're stuck with me. And this is my insanely spoiled cat, Lucy. She's absolutely adorable. But more about my professional background is I have an MBA in healthcare management, an MPH, and I have a master's in library and information science. I also have a postgraduate certificate in interprofessional information, which is just a fancy way to say healthcare research for librarians. And I'm happy to bring any of that knowledge that I've learned into any of the consultations that we do. So, if you have study design questions or questions about anything else, I'm happy to answer them if I have any level of expertise. In terms of my own personal research, I'm really interested in meta research. So here at Yale, I partner on a lot of different systematic reviews, and I'm an expert in systematic review methodology. But I'm also really interested in the research surrounding the methodology of systematic reviews, in particular, research around reporting guidelines and how they're being used. I also do real estate on the side, so I'm interested in research around the intersect of housing and public health. So if you want to talk about green spaces or community gardening or anything like that, I'm also super interested in those. My MPH thesis was about social media and health literacy and misinformation. In particularly, I pulled videos on YouTube about Mullerian anomalies and discussed the reliability and information found within those for patient education. So probably too specific to be helpful to anyone here, but I am happy to talk to you about web crawlers or retrieving information from social media or anything like that. Okay, so first we'll talk about access. There's a lot of different ways that you can interact with the library while you're here at Yale. We have physical locations. So the first one is the Cushing Whitney Medical Library at the Sterling Hall of Medicine. We're in the L wing. L stands for library, so it's super easy to remember. And we have wide availability of our hours. We're actually open Sunday through Thursday till midnight and Fridays and Saturdays until 10. But after hours, we do have a 24/7 computing and study space. There's about 10 computers down there, and one is a supercomputer. So you always have access to printing or computers or Wi-Fi, or a space to just hang out if you need one. Although I will say the hospital has a lot of really great spaces too. In addition to our physical location at 333 Cedar Street, we do have a location in the St. Mayfield's building. It's called the Clinician Study Center. It's actually in the most random place. So if you are in the Orchard Medical Building and you are standing in front of the urology patient waiting room, if you turn to the left, there is a hallway right there. And the last few times I've been, it's being used for storage. So it doesn't look like you're supposed to walk down it. But if you walk all the way to the end of the hallway, there is a door that is totally not labeled at all. If you swipe your badge on that door, you open it, and I say it's like entering Narnia, because you walk through and it is this beautiful library space with a bunch of different computers, a printer that is always magically filled to the brim with paper, and totally free to print. And then, these beautiful windows, and it's just really lovely. Although I will say, there is ambulance noise because it's right outside of the emergency room. Although I imagine that noise tends to get dulled out the longer you sit there. Okay, I will say that we do office hours over there occasionally, but please feel free to use the librarian space if you would like. Every time I go over there, it's empty, so it is the perfect place to hide if you have to do dictation for your notes or take a HIPAA-related phone call. It's really an ideal space for that. So please feel free to use it as your office if you need it. Okay. In addition to our physical locations for the medical library, we also have a lot of different libraries on campus. So we have the Sterling Memorial Library, which is the picturesque Yale library that you're probably all thinking of. And then we have like the Bass Library and Marks Library, the Divinity School Library. So if you need a place to study that is outside of the medical campus, there are places all around New Haven that you're able to badge into with your ID. In addition to our physical locations, we do have a lot of different ways that you can access our resources online. So we have support for clinicians and YNHH. This is a website that we built out specifically for this group because we wanted a place with all of our great point of care tools, all of our evidence-based resources, and the resources that you really need for your patient care. In addition to that, on this page, we also have all of our mobile apps, and I do recommend that you download them not only on your mobile heartbeat phones, but on your personal devices too. Then we also have off-campus access to the library. So I will say that there's one not listed here. You can access our material through Citrix through the hospital's network. We generally just don't recommend this because so many things are blocked on the hospital network that you'll have access to a lot more material if you access it from the university website side. And this could be using your YNHH credentials. The Yale New Haven Hospital ITS has to block things because of all of the technology threats that hospitals are currently experiencing. So the two alternatives to Citrix is to download the Yale VPN, which is something that you would download from the software library. You sign in, your computer officially thinks that you're on Yale's campus. Alternative to that, we have the Easy Proxy, and it is just as easy as the name sounds. So the Easy Proxy, you just start at the medical library's website. All of our links are easy proxied. So if you enter something that has a paywall. The first time you enter it, it will ask you for your Yale login. So this will be your net ID and password through the university, or your Epic login through the hospital. You log in that first time, and then you don't have to do it again as long as you're using those proxy links until you close your browser. And this does not involve you downloading anything, so you can do it on any computer, and it's really easy. Another thing I always like to highlight in our online locations is that, well, we have a very robust collection here at Yale, and we attempt to purchase everything that you could potentially need. Obviously, we can't own everything in the world. So if you ever hit a paywall and it's something that Yale does not subscribe to, we do have interlibrary loan. And I've actually had people, when I'm giving the same talk, put in an interlibrary loan, and they actually receive the article before I'm even done talking. So they're generally really fast. But obviously, it could potentially take longer than that. I think they say 1 to 3 days is the general turnaround time, but I would say things are pretty fast. So if you ever need to put anything in through interlibrary loan, I do recommend that. It's completely free. And then we also have our emails. So we have the clinical librarians at Yale, the clinical librarians at YNHHS.org, my information at both domains. You can email us anywhere. It will get back to me, and I will help you as soon as I can. In addition to emails and the website, we actually do have a request a librarian form or ask a librarian form in the Epic portal. So if you go into Epic, we have a library resources tab. Within the library resources tab, we have some of our point of care tools like Visual DX up to date, and then this ask a librarian form. So you don't even need to leave the patient record to send me a question. Anything that gets entered through Epic is treated as urgent patient care. So we try to respond within the same day with those requests. All right, so let's get into the ACGME core competencies. So the first one up is practice-based learning and improvement. And so we have a lot of different resources that will help you with your practice-based learning and improvement. My particular favorite resource is TRIP, which is Turning Research into Practice. Give me just a moment. I'm going to pull up a page. We're going to start at the medical library website instead of TRIP. Okay, so this is the medical library website, and I just want to quickly take you through some of our pages so that way you are aware of where to find things. So our popular resources are here. I always like to recommend the PubMed at Yale. So you can actually use this PubMed at Yale, and if you're searching PubMed through the PubMed at Yale, you don't have to even use our easy proxy on our website. This will give you our link resolver, and you'll be able to tell where exactly we have the resources or order them directly through Interlibrary Club. On this side, we have support for some certain things. So we have the clinicians page, the public health page, the systematic review page, and then below we have some of our upcoming trainings which may be helpful. I do want to highlight, we do have 2 different catalogs. We have the Orbis catalog and the Quick Search catalog. Generally, if I have a textbook that I'm looking for and I have the ISBN or the ISSN, I will search in Orbis. Quick Search is a little better if you are searching for articles or books or a database. It's a bit more robust. It also has some of our special collections in there where that information isn't included in Orbis. I will say with Quick Search, the other parts of campus will use it in lieu of like a database. So they will search it instead of searching PubMed. But I feel like in medicine, our databases and the capabilities, the search capabilities within those databases is so great that we wouldn't use Quick Search in that way. But it's really great if you have a known article and you're trying to find out if Yale has access. You could just take the title of the article, throw it into Quick Search, and it'll map and tell you if we have it. Okay, so support for clinicians, just to highlight things on this page. We have our point of care tools, and so we have Dynamed and UpToDate. I do recommend that you check those out. Dynamed is the competitor to UpToDate. We have our point of care tools here. So we have our clinical key, Gideon, which is an infectious disease database. Then we have PubMed at Yale. PubMed Clinical Queries is also really great because it allows you to quickly filter down to that clinical information that you might need. And then we also have more information over here with the educational videos, which I'll highlight over. I just want to highlight on this page that we do have our newsletter here, our clinical newsletter. We do plan on sending it out more than biannually. We believe every other month, but that's subject to change. I recommend that you subscribe to this. The emails will come out and it will include some of our clinical resources and how to best use them. So you may learn something really important or helpful. Now I'm going to go into TRIP and kind of show off why I think that this is a great tool for practice-based learning. So if we go in, you'll see that TRIP is actually free, so it's very similar to PubMed. But Yale subscribes to the TRIP Pro version, which gives us more access to the additional data within their database. It also allows us to download RAS files. So if you're saving everything in a citation manager, that can also be great. If we go into the PICO search, this is a great way to search. It allows you to break down your question by PICO. They also have an advanced search here where you can do a more complex search. So I am going to do diabetes or diabetic. Don't want to do that. I'm going to do GLP-1s because they're very popular right now. And say I'm really interested in hypertension or blood pressure. Okay, so when I go in, we'll see that there's actually not that much research currently on this. Let's get rid of our blood pressure outcome. So way more looking at diabetic patients taking a GLP-1. You'll see that there is 138 systematic reviews. So if you're quickly trying to find the highest level of evidence, this would be a really great way to quickly filter that down without having to go hundreds of records in PubMed. I will say TRIP focuses on that high level. So you're going to have your systematic review papers, your guideline papers, your regulatory guidance. And then you'll have your control trials and primary research. If you're looking for something that's more observational in nature, I wouldn't recommend TRIP as the #1 database. And I also typically won't recommend it if you are doing exhaustive searching. Although I always like to highlight this. It does have ongoing systematic review registries. So from Prospero. So if you are doing a systematic review, this is a great place to search to make sure that your topic isn't already being done. Obviously, you want to look at the year. If something said 2018 and it's still not being published, potentially the team has abandoned the project. But this has way more robust search methodology and functionality than the Prospero website itself has. So it's really great. And you can also search for ongoing clinical trials, which could be helpful if you're looking for something brand new. They do have patient leaflets, some blogs, and some textbook information in here too, if that's what you're more looking for. I think the major difference from PubMed, for me at least, is the guidelines. I really like that I'm able to sort the guidelines by location. So for instance, if I was interested in the GLP-1 guidelines in the USA, I could quickly look to see what the American Diabetes Association has come out on those. If I was looking more internationally, I could look at this, BNJ. So clearly that is based in the UK. But if you were specifically doing a search in South Africa, this is really helpful because you can limit by country. All right, so that's TRIP. I highly recommend it. I think it's a really great database, and it's also free, so you'll still have access to it while you're after you potentially leave Yale. In terms of library services related to evidence-based practice and improvement, we do have an evidence synthesis service, and we do partner with teams on evidence-based practice changes within the hospital. So if you're doing any of these types of exhaustive searches, we can help you with those. We do, for our systematic review service, require a protocol for us to review before we start working on a project. But definitely reach out to me if that's something that you're interested in. I'm happy to chat with you about our service and your research question. In terms of patient care and procedural skills, we have those point of care tools that I talked about. So we have up-to-date 5-minute consult. And if Visual DX isn't something that you've checked out very recently, I do recommend that you check it out because it is turning into more of a competitor to UpToDate and Dynamed than, than a dermatology resource that you may think of when you hear the name Visual DX. I also really like their differential tool, although I'm not a physician, so I do not know how useful it is if you've gone to medical school and you have that background. But I think it's so. Then in terms of services, we also have mediated searches and consultations. My information to contact me is located here. Our next page is going to talk a little more about our mediated search service. So in terms of our search service, once you're here at Yale, you actually don't have to do any searching if you don't want to. I'm available for you. Although I will say there's a lot of you and only one of me. I do try to get things back within a few days. And if you tell me that it's urgent for patient care, I will throw it on the top of my file, drop everything and do it for you. So we just need to communicate on how fast it needs to be done. And I kind of have two ways that I generally set up this service. So we can communicate by email, or you can set up a meeting. So if you're coming to me by email and you just want to do email, there's some things that will help us facilitate the communication and make sure that you're getting what you want as fast as possible. So first things first is I need to know your timeline, right? So if you need this tomorrow, I need to know. And if you need it in 2 weeks, or you want to look at it in the next week so that it's ready for something in 2 weeks, that's all very helpful for me to know. It's also helpful to know the limitations of the search that you would like. So for instance, if you're only interested in RCTs, that is particularly helpful so that I can curate the list down by limiting the search to RCTs. If there's a certain year that is particularly important, that is also helpful, or if you just want the last 5 years or the last 3 years, any parameters such as that related to year. Are you going to look at things in other languages? I don't want to send you more material that you're not going to find useful. Conference abstracts also are pretty important. So conference abstracts are really good if you're doing a quality improvement patient safety question, because a lot of times there's a publication bias in those publications, but people do go present them at conference abstracts as conference abstracts. Conference abstracts are also really great if you are doing something that's brand new and hasn't made it to full manuscript yet. But if you're not going to look at the conference abstracts, then let's avoid them and save you the trouble. My next question is, would you like the results curated? And so with this is, if so, how many results do you want? If you're like, I do not even want to sort through more than 20 papers, that's really important for me to know so that I can best answer your question. If you're like, I don't want you to curate at all, and I want to look at everything that is retrieved by the search, that's totally okay too. I just need to know one way or the other. If you would like me to curate the results, sometimes providing an example article is helpful. So if you have one that you already know about, please feel free to forward. It's so much easier when I'm looking for something similar to something else and I have an idea of what you're looking for. And then lastly, how would you like the results? So are you using EndNote or another citation management software? Are you not using a citation management software? I'm happy to send them to you in any format. I just need to know what format. Okay, so that's my email, which is mostly is asynchronous. But then we can also meet. So this could look two different ways. So I'm happy to hear about your project or your search or your research question, and then live search as you're talking, and see what we're coming up with and how things should be edited to get you something reasonable. We can also do more of like a training where like you could search and then I would tell you how I would approach the search. And we can go from there to you know, curate a list of information that would be helpful for you. So to do a meeting, you would just schedule time on my calendar. Please don't ask to schedule time, just schedule time. There's a link for you to schedule it. You don't need to ask. I'm always happy to meet as long as there's time on my calendar. Just reserve a time and you can tell me the location of where you would want to meet. Yeah, so super easy. The link to the calendar will be in the slides that I'm going to make available with this recording, but it will also be in the bottom of all my emails in my signature. I also like to highlight right at this point that I work atypical hours. So I'm Sunday through Thursday, 12 p.m. to 8 p.m. I am a night owl. So you are more likely to get an email from me at 2 a.m. than 8 a.m. But that being said, I'm always happy to switch around my schedule if those hours don't work for you. So just let me know. And sometimes I do overflow meetings on Fridays. So, you know, definitely flexible on that whenever you guys need. Okay, so if we're talking about systems-based practice, we have a lot of resources that can help you with this. So we have special databases in particular that I would recommend. So for instance, we have the Healthcare Administration database. So this is a curated database of different journals that publish in patient safety and health care administration. And so these are often one of the hardest things to search for in the medical literature because there's so many ways to describe this type of evidence. So if you're doing a patient safety or quality improvement project, I actually recommend that you don't start in PubMed because it's just a way too big of a database for that. Start in healthcare administration and see what you find. It's also really good for like cost-effective analysis studies or anything like that. If you're doing something that is more public health related, I do recommend that you check out our public health resource guide. We have lots and lots of special databases available to search for public health. And this is, you know, varying on things that are subscription-based, like Ovid, Global Health, or a policy database that can be really helpful if you're looking for policy information, to public-facing ones like the WHO's regional databases. If you're doing something, you know, in the Caribbean, you may want to search lilacs, etc. So it's definitely something that you should check out if you're planning on doing research within the scope of those. We also have a lot of different services. So like I mentioned before, I'm your point person, but there's a lot of other librarians that can help you at the medical library. So I just always love to highlight our research librarian, Caitlin. She's so wonderful. But Caitlin can help you in multiple different ways. So she can help you with a research data management plan. So if you're thinking those out or trying to get compliance with an NIH grant, that is something that she, you know, it's her bread and butter. She knows all about. So if you contact me, I'm happy to give you a referral, or you can feel free to contact her directly too. In addition to the compliance and the research data management plans, she also can help you find freely available research data if you're trying to do a secondary analysis or looking for like a data to compare with data that you have locally from Yale. So that's all something that she can help with. We do license some research data, but it's very specific on our collection development policies on what we're allowed to license. So all of our data sets are available in quick search, our library catalog. So if you're looking for them, I know the American Hospital Association data set is one that it gets a lot of use. But we do have other data sets, and we can help you find data sets, and we can attempt to purchase other ones if there's something of interest. Okay, so in addition to the research data librarian, we do have other librarians here at Yale. Because I have an MBA, I mostly take all of my own business questions. So if you have a business related healthcare question, I'm happy to answer that question for you and search in the business literature. But they're also available, so I'm happy to refer you over to if something is above my knowledge. We have a librarian at the Science and Social Sciences Library, so potentially you could get referred over there. I think the one that I refer to the most is the law libraries. Our law librarians are actual lawyers, like they have law degrees. So I do not have that subject content expertise. So they're definitely the experts there. And if you're doing something with healthcare advocacy or policy and you need to speak to one of the law librarians to find evidence or discuss your question, definitely happy to refer you. Okay, so the next one is interpersonal and communication skills. The resources for this are pretty obvious. So you have the rationale clinical exam from JAMA. Clinical Key has a lot of interactive learning sections. And then the Bates Visual Guides physical examination. In terms of services, we actually have a lot of services related to professional and communication skills. So you have our scholarly communication service line where we can discuss anything from publication, understanding your H-index, understanding journal impact factor, to publication support. So do you want to talk about our APC waivers and discounts? Do you need help trying to figure out what journal is the best one to submit to? So those are all available, and I can help you with any of those. And she can teach you best practices for graphic design on your posters. So she has an email class. She offers classes about poster design in our library calendar. And then she also meets one-on-one for people that need more. I highly recommend that you use Dana. She helps me on all of my posters and they look so much better after she touches them. Okay, so in terms of professionalism, we have a lot of resources on the library's website. So these are mostly guides and curated lists. So for instance, we have the LGBTQIA+ health guide. And so this is a lot of resources compiled to help practicing clinicians care for this population, and a whole bunch of resources specific to them. We also have a race and racism in healthcare guide, which provides a lot of additional information and resources if you would like to learn more about racism in healthcare. Our skin of color guide is slightly different. This is highlighting resources that have more skin of color resources in their evidence. So for instance, like if you're looking at a rash and you need to see it in more skin tones, if you go to the skin of color guide, it will recommend books and resources and databases that have more additional things that you potentially could find that resource. We also have our graphic medicine collection, and this is brand new. We're really excited about it, and it's a great collection, so I recommend that you check it out. In terms of library services related to this, we do have a wellness space in the Morris Reading Room, and the Zen booths down in the basement. The Zen booths, which are pictured here, are very small and they're soundproof. So if you need to take those HIPAA-related phone calls, you can do it in the Zen booth. I sometimes see the medical students down there studying in them. They are way too small for me. I would feel a bit claustrophobic, but to each their own. If it works for you as a study space, even better. It is very quiet in there. In addition to these, we do have some other things I just want to quickly highlight. So in the Morris Reading Room, right next to the wellness space, we do have our board game collection, which goes out for 7 days. So if you want to rent a board game to do something on your days off or to leave in the resident lounge, you can check out a board game and play it. You have 7 days, so hopefully you're able to finish it in that time period. We also have everything you need to make a movie. The medical students have to make a movie as part of their curriculum. So from green screens to rolling dollies to GoPros to camcorders to cameras, everything like that we have available at the circulation desk to check out. And then we also have things like cell phone and computer chargers too. So if you leave it at home and you need to charge your phone or your computer, stop by the circulation desk. We have this available. Okay, so that is the end of this presentation. I hope this was helpful. I look forward to collaborating with you in the future. Here is our library website and some ways to contact the clinical librarians. Have a very nice day.